It's well documented. But part of what pays for it is kicking 15 million Americans off of their affordable health care. And you're Secretary of Health. So here's my question. You've met with the CEO, won't have their health insurance again.
They're almost all illegal immigrants.
Oh, well, you know what? It sounds like you haven't met with folks like Portia in my district.
We found one.
My question, Mr. Secretary, is have you met with anybody that's lost their health insurance? And it sounds like the answer is zero. So my question was, you've had time to meet with them as you're trying to make America healthy, that they now can't see a doctor anymore because of the policy.
Point them to other options. And President Trump is trying.
When somebody's health insurance cost goes up $500 a month because of Donald Trump's policy, I don't.
Time has expired. I now recognize the gentleman from Texas, Mr. Casar.
Good morning, Secretary Kennedy. I have a few questions about who you're meeting with and talking to as you make this nation's health care policy and health policy. According to reports, you and President Donald Trump met with the CEOs of Pfizer, Eli Lilly, Pharma, and others at Mar-a-Lago. Is that correct?
Yes.
And you've also met with the CEOs of Pepsi and Tyson and Kellogg's. Is that correct, Mr. Secretary?
We met with people on both sides of the issue.
Yes.
Of course.
The CEO.
We're going to meet with industry.
Yeah, and the CEO of Starbucks as well. Is that correct?
Yeah.
Thank you. Do you know how many billionaires you've met with in your time in office?
I would have no idea.
Well, at least at a cabinet meeting, there's, of course, Donald Trump, Mr. Lutnick, Ms. McMahon, Mr. Musk, so at least 4 or 5. So we've established here you've met with a good number of CEOs, some billionaires. I hear you've even met with Kid Rock. So here's my question. The Trump policy that passed through the Congress was to give some of these ultra-wealthy people a tax cut. And part of paying for it, the big ugly bill gives the ultra-wealthy a massive tax cut. It's well documented. But part of what pays for it is kicking 15 million Americans off of their affordable health care. And you're Secretary of Health. So here's my question. You've met with the CEOs, you've met with some billionaires. How many people have you met with? How many Americans have you met with that have lost or about to lose their health insurance?
Well, I've met with the advocacy community on virtually everything that we regulate. I've met with more tribes and tribal leaders than any HHS Secretary in history.
And I'm grateful for your meeting with tribes and advocacy organizations, but have you met with everyday Americans who have lost their health insurance just this last year?
I meet with everyday Americans every day.
And have you had conversations with those Americans who will lose their health insurance this coming year or next year because of the cuts to Medicaid? Have you met with people who have lost their health insurance?
First of all,
what you're watching here is the moment the exchange sharpens into a clear line of conflict. The question is simple and repeated. Have you actually sat down with people losing coverage? And instead of a direct answer, we get a pivot from lived experiences to statistics and broad claims about spending increases. That's a classic shift from individual impact to policy framing. But notice what's missing: a specific example, a name, a conversation. When a public official moves away from direct human impact and toward abstract numbers under pressure, it often signals a vulnerability in the argument. So the real question for viewers becomes, if the policy is working as claimed, why not point to those real conversations directly?
No cuts in Medicaid. There are no cuts in Medicaid. Look at the CBO report from this week. We are increasing Medicaid spending by 47%
so we've got,
over the next 10 years.
So over $1 trillion comes out over the next 10 years. Report after report says 15 million people could lose their health insurance.
How is that a cut?
Okay, let's talk about
that. That is only a cut in Washington, D.C.
Have you met with any of the 1.4 million people who have lost their health insurance just this last year from dropping off of Obamacare? Have you sat down and talked to those folks about the fact they won't have their health insurance again?
They're almost all illegal immigrants.
Oh, well, you know what? It sounds like you haven't met with folks like Portia in my district.
We found 1.5 million illegal immigrants illegally collecting Medicaid.
Mr. Secretary, there are people like Portia in Buda, Texas, whose health insurance costs went from $100 a month to $500 a month. People like my constituent Shauna in San Marcos, Texas, her premium went from $250 to $750 a month. Now, $500 a month may not be a lot to you or to some of the billionaires that y'all are talking to, but for these moms with kids, they've lost their health insurance this last year. So have you had a conversation with, how many people have you sat down with that have said, Mr. Secretary, I lost my health insurance this last year. What are we going to do about it?
87% of the people who are on Obamacare are paying less than $96 a month. 54% of the people who are on Obamacare today are paying less than $50 a month.
Well and good for us to talk about Obamacare policy.
By
But the
way,
question is,
Democrats,
it sounds like the answer.
Democrats had 3 chances to make.
We could talk all we want about the past.
Tax credits.
We could talk about.
Why didn't you do it?
We could talk about the past.
Why didn't you do it when you had the power to do it?
Mr. Secretary, just like you, I'm new here. I'm responsible for what's happening right here and now.
Yell at your colleagues.
My question, Mr. Secretary, is have you met with anybody that's lost their health insurance? And it sounds like the answer is 0. So my question was, you've had time to meet with the billionaires. I know it's a lot of fun to meet with Kid Rock.
True, I have met with people
who have lost their health insurance because of the policy from this last year.
Yeah, people have come up to me and said that they've lost their health insurance, and I talked to them.
And what have you said to them? How can you explain to them how, as you're trying to make America healthy, that they now can't see a doctor anymore because of the policy?
Point them to other options. And President Trump is trying.
When somebody's health insurance cost goes up $500 a month because of Donald Trump's policy, I don't see how you could honestly tell them how you're going to make this better for them.
It is the Democratic policy to benefit billionaires. The insurance companies' stocks raised by 1,000% after Obamacare was passed. The money was not going to Americans. It was going to them, and it was you who did it.
The gentleman's time has expired. We need to move on.
Chairman, it just sounds like he's met with nobody and been able to explain to them why it's okay that this policy kicks them off their health care.
I now recognize the gentleman from North Carolina, Mr.
This exchange ultimately comes down to something much bigger than a policy disagreement. It's about credibility, accountability, and the gap between data and lived reality. Throughout this questioning, one side is trying to ground the conversation in real people, constituents with rising premiums, families losing coverage, individuals facing immediate consequences. The other side consistently shifts toward broader narratives, total spending increases, percentages, and systemic explanations. And while those points may be valid within a policy debate, they don't directly answer the central question that was asked multiple times. Who have you personally spoken to that is experiencing this loss? That repetition matters. In high-pressure hearings like this, when a question is asked again and again in slightly different ways, it's usually because the answer hasn't landed or hasn't been given clearly. And here, that tension becomes the core of the moment. The audience isn't just hearing 2 perspectives. They're watching a disconnect unfold in real time. Another key moment is the shift toward attributing coverage losses to specific groups or past policies. That move attempts to redirect responsibility, but it also risks sidestepping the immediate concern being raised. Because for viewers, especially those outside Washington, the question isn't about which party is to blame historically. It's about what's happening right now and whether leadership is directly engaged with those consequences. And that's where this exchange becomes revealing. It's not just about healthcare numbers or legislative outcomes. It's about whether decision-makers are connected to the people affected by their decisions in a tangible, personal way. Saying, I meet with everyday Americans is broad. Naming specific conversations, specific stories, that's concrete. And in moments like this, that distinction can define how credible an answer feels. There's also a political layer here that shouldn't be ignored. The framing of billionaires, CEOs, and high-profile figures versus everyday constituents creates a contrast that's easy for audiences to grasp. Whether fair or not, it raises a perception question. Who is getting access, attention, and influence? And in politics, perception often carries as much weight as policy itself. By the end of this exchange, the takeaway isn't necessarily about who won the argument. It's about what was answered and what wasn't. The repeated attempts to bring the conversation back to direct human impact and the consistent movement away from that focus leave viewers with a clear impression. There's a gap between policy defense and personal accountability. And that's what makes moments like this powerful. They don't just inform, they reveal. If you found this breakdown helpful, share your thoughts in the comments. Do you think the question was answered or avoided? Don't forget to like, share, and subscribe for more in-depth political analysis that cuts through the noise.